Okay, hi everyone. So today I'll be giving a presentation on the malaria disease. So some of the main objectives of today's presentation is to gain a more in-depth understanding of the malaria disease as a whole, as well as its causes and origins. We'll also be examining the ways in which malaria spread, as well as prevention methods for those living or visiting malaria endemic countries or regions, as well as the sort of limitations and disparities that come with those prevention methods. We will also be looking into treatment options for those that are infected by the parasite and limitations and disparities associated with that as well. And this is just a table of contents with all the topics that I will be discussing in today's presentation. Okay, so what is malaria? Malaria is a highly infectious and life-threatening mosquito-borne illness that's caused by the Plasmodium parasite. The parasite is transmitted through the bite of an infected female Anopheles mosquito. There are a number of species of Plasmodium that are associated with malaria, which we'll be talking about a little bit later. But Plasmodium falciparum is considered one of the most dangerous species of Plasmodium. The most dangerous species of Plasmodium. It is associated with the majority of malaria-related cases and deaths worldwide. Malaria evolved in Africa sometime between 2.5 and 30 million years ago. In 2020, there were an estimated 241 million cases of malaria worldwide. Additionally, the estimated number of malaria deaths stood at approximately 627,000 as of 2020. Approximately 95% of malaria cases and deaths worldwide were concentrated in Africa, predominantly in the sub-Saharan Africa region. This region is disproportionately impacted by the burden of malaria. And so before scientists and physicians were able to connect the symptoms of malaria with the mosquito bite, early interpretations of the disease were rooted in the miasma theory. So this theory held that certain diseases or illnesses were caused by miasma, which was given off primarily from rotting or decomposing material that polluted the atmosphere and in turn spread various diseases. In fact, the word malaria comes from medieval Italian, which translates to bad air. It wasn't until 1897 when a British physician by the name of Sir Ronald Ross demonstrated the relationship between female Anopheles mosquitoes and the transmission of malaria parasites into our bloodstream. His discoveries and his research on malaria led to major advances as it pertained to understanding how certain diseases developed. His contributions also impacted the scientific world for years to come. And so this graph displays data from the World Health Organization regarding global malaria deaths by world region from 2000 to 2020. And the reason why I wanted to show this graph was just to put into perspective just how much this disease plagues this particular region in comparison to other parts of the world. Like I had mentioned earlier, 95% of the deaths associated with malaria were concentrated in the African region, which is demonstrated in this graph. And these are just some common signs and symptoms for those infected with malaria. These symptoms often manifest within 1 to 4 weeks following an infection. It is important to be mindful that if this disease goes untreated, it can be fatal. So some symptoms include high fever, chills, aches, like headaches, muscle aches, fatigue, nausea. Individuals may also experience profuse sweating, vomiting, diarrhea. These symptoms are often fairly mild in the beginning, so it can be difficult, to attribute these symptoms to malaria. So, since tropical and subtropical areas are typically considered high risk malaria regions, it is crucial for individuals that live in or travel to these areas to seek out medical help in case they do start to experience any flu like symptoms or sickness. Um, there, there are also various other complications that may arise as a result of severe malaria. For example, anemia and jaundice are very common potential outcomes following an untreated infection. And this is mainly because malaria it infects red blood cells and causes them to ultimately rupture following an infectious cycle. So that can lead to several different complications in the body. One may also develop liver problems, splenomegaly, which is essentially when the spleen enlarges and swells and ultimately can rupture as well. So the symptoms of malaria can turn severe fairly quickly. So one should reach out to a medical professional if they are suspicious that they may have been infected. So, as mentioned, malaria is spread through the bite of an infected female Anopheles mosquito. There are 5 potential parasites that can cause malaria in humans, those being Plasmodium knowlesi, Plasmodium malariae, Plasmodium vivax, Plasmodium ovale, and Plasmodium falciparum. And so the Plasmodium falciparum parasite is the most deadliest species of Plasmodium that causes malaria in humans. There are many attributes that make this parasite particularly dangerous and adaptable, allowing it to spread the parasite to various individuals and other mosquitoes. There has been research done showing that the Plasmodium falciparum parasite is able to impact its vectors, the female Anopheles mosquitoes. It's able to impact their feeding patterns. And this is important because this can allow the vector to go on and infect more individuals over a shorter period of time. In addition, the female Anopheles mosquito is a very effective vector for this parasite, as it's able to adapt to a wide range of different environmental conditions. This makes malaria not only very transmissible, but a very difficult disease to control, especially since there is such a high prevalence of these mosquitoes in Africa. So, malaria can't be spread directly from person to person unless an infected individual went through a blood transfusion or a organ transplant, or they were sharing needles and syringes contaminated with blood. But so when mosquito bites, a female Anopheles mosquito bites an individual that is already infected with malaria, that mosquito will then become infected with a parasite, which will allow it to in turn spread that parasite to the next person that it bites. So I included this figure to kind of demonstrate exactly that. So here we start off with an infected mosquito, and that mosquito goes on and infects person A. So the mosquito enters person A's bloodstream, travels to their liver, infects the liver, they multiply in the liver, and then after they mature, they leave the liver, they infect our red blood cells. And then if an uninfected mosquito were to come and bite person A, that mosquito would then become infected with the parasite, and the next person they bite, person B over here, they would ultimately become infected as well. And this cycle just continues on and on and on. And this is a map from the World Health Organization. It shows the estimated malaria incidence per 1,000 people as of 2019. So we really see that increased malaria incidence in sub-Saharan Africa, a lot in Mali, Nigeria. We see a lot concentrated in the Democratic Republic of Congo, Mozambique. Yeah. And then this map displays the estimated malaria mortality rate per 100,000 people. So again, we see that concentration in sub-Saharan Africa. And just to put it in perspective, Nigeria is indicated as this orange color. So there were 50 to 100 estimated deaths for every 100,000 people in Nigeria in 2019. So, and then Nigeria's population is close to around 206 million people. So it's evident, that these numbers are very significant. Okay, so prevention. There are a number of anti-malarial drugs that may be prescribed to individuals traveling to malaria endemic regions. Some common ones are Malarone, Mefloquine, chloroquine, primaquine, doxycycline, and sulfadoxine. Depending on the length of one's trip, how often a patient is comfortable taking medication, cost, as well as one's comorbidities, a provider will be able to prescribe the best drug for the patient. Pregnant women and children living in these regions may also be recommended to take certain anti-malarial drugs. It is important to mention, however, that these drugs are not 100% effective and must be taken in addition to other preventative measures to minimize the risk of potentially being bitten. These can include using mosquito repellent insecticides, mosquito bed netting treated with insecticides, as well as clothes that minimize skin exposure, and also clothes treated with insecticides like permethrin, for example. Additionally, the malaria vaccine is also recommended for children living in malaria endemic regions, as it has been shown to significantly reduce malaria in young children. So, some limitations to being able to take these prevention methods are the inability to afford the expenses of anti-malarial drugs, the insecticides, as well as travel expenses to clinics and hospitals. Insecticide resistance is also rising over the years, which can compromise malaria vector control in these areas, which can make the disease even more difficult to control. So, if one is suspicious that they may have been infected with the malaria parasite, a diagnostic test may be done. And this examines the patient's blood for the presence of the parasite. From there, infected individuals will likely be recommended to take certain anti-malarial drugs for a set number of days to treat the infection. A common one being chloroquine for infections associated with the Plasmodium falciparum parasite, but other drugs or a combination of drugs may be recommended in case of chloroquine resistance. And again, being able to afford the expenses of anti-malarial drugs or the expenses to travel to clinics can pose as a significant barrier to receiving treatment in the African region. Additionally, the increase in anti-malarial drug resistance can pose as another significant barrier to receiving care and treatment. The anti-malarial drug resistance can also be attributed to rising malaria-related cases today. And so, in summary, as mentioned, malaria is a highly infectious mosquito-borne illness transmitted through the female Anopheles mosquito. A majority of the cases are attributed to the Plasmodium falciparum parasite. Delay in treatment can be fatal and can lead to a wide range of different complications in the body. 95% of malaria-related cases and deaths worldwide are concentrated in Africa, predominantly the sub-Saharan Africa region. Anti-malarial drugs, as well as other preventative measures, may be used to prevent the likelihood of contracting malaria. Different anti-malarial drugs may also be prescribed to help treat infected individuals. But again, limitations do exist, drug and insecticide resistance being a major one, as well as inability to afford health care and travel expenses to clinics and hospitals to get these medications can be a tremendous detriment in these areas to getting the care that they need. And so I have some trivia questions that I came up with to test what we learned about malaria. So the first one, infections caused by which species of the Plasmodium parasite is considered the most prevalent as well as the most life-threatening? A, Plasmodium vivax, B, Plasmodium falciparum, C, Plasmodium malariae, D, Plasmodium ovale. And so the answer is B, Plasmodium falciparum. And so here I just have a macro gametocyte and a microgametocyte of the Plasmodium falciparum parasite. Okay, and what were the early interpretations of the cause of malaria disease? A, early scientists and physicians always knew that the malaria parasite was transmitted through the female Anopheles mosquitoes. B, it was believed that malaria was spread due to a curse from God or other demonic presence. C, it was believed that malaria could enter the body through inhalation of polluted vapors. D, malaria was spread through miasma or bad air, quote unquote bad air, that was resulted from decomposing and organic material that contaminated the atmosphere. And E, both C and D. So I'll give you a couple of seconds to think about it. Okay, and the answer is both C and D. Malaria was originally thought to spread through polluted vapors resulting from decomposing material. And this is just a illustration to the illustration of the miasma theory, essentially. And then the last one, what are some limitations that can prevent individuals in malaria endemic regions from preventing malaria or receiving treatment? A, insecticide resistance. B, anti-malarial drug resistance. C, lack of funds to afford treatment, travel, expenses to clinics. D, A, B, and C. E, there are no limitations that prevent individuals from preventing malaria or seeking out treatment. Okay, you can pause and think about it. Okay, and the answer is D, A, B, and C. And this is just a graph showing that the cases have been rising in Africa due to anti-malarial drug resistance over the years. And yeah, that's it. These are my references. And yeah, that was my presentation. I hope you guys enjoyed it.